Today we're going to be talking about something serious: the warning signs of blood clots. Blood clots can be life-threatening if not caught and treated in time, so it's crucial to recognize the early signs. In today's video, we'll cover the symptoms of different types of blood clots: deep vein thrombosis, pulmonary embolism, and clots in the heart and brain. So, make sure to stick around till the end of the video for some essential prevention tips. Blood clots are gel-like masses that form from blood cells, platelets, and fibrin. They form in your blood vessels to prevent excessive bleeding after an injury. However, when they form without an injury or don't dissolve on their own, they can be dangerous. Some of the risk factors why blood clots happen include sitting for long periods of time, recent surgery or injury, being on bed rest, certain medical conditions, taking birth control pills and hormone replacement therapy, genetics, obesity, smoking, age, and chronic inflammatory disease. There are two main types of blood clots. First is thrombus. This is a clot that stays in place where it is formed. Second is embolus. This is a clot that breaks loose and travels through the bloodstream. Blood clots can form in different parts of the body. They form in the veins, which is called deep vein thrombosis or DVT. DVT is the most common type of blood clot. They usually form in the deep veins of the legs, but they can also form in the arms, abdomen, or pelvis. When these blood clots from the deep veins travel to the lung, it can cause a condition called pulmonary embolism, which can be life-threatening. Pulmonary embolism occurs when one or more arteries in the lungs become blocked by a blood clot. This blockage can reduce blood flow, decrease oxygen levels in your body, and damage your lungs and other organs. Blood clots can also form in the arteries known as arterial thrombosis, which can block blood flow to the heart, brain, or other organs. This can lead to serious problems such as heart attack or stroke. The most likely cause of arterial thrombosis is artery damage due to atherosclerosis. Atherosclerosis occurs when a person has a buildup of plaque on the walls of their arteries. So, what are the signs you're having blood clots? Let's begin with the signs of deep vein thrombosis. This type of clot usually forms in the deep veins of the legs and can be very serious if not treated promptly. Here are the key signs to look out for. 1. Swelling. Swelling of foot, ankle, or leg, usually on one side, is one of the most common symptoms of DVT. The swelling occurs because a blood clot blocks the flow of blood, causing it to back up behind the clot. 2. Leg pain. This pain can feel like a cramp, dull ache, or tightness in your calf, often on just one side. It might appear suddenly and worsen with activity like walking or flexing your foot. The pain can range from mild discomfort to severe. 3. Warm to touch. The skin over the affected area might feel warm to the touch. This is due to the inflammation caused by the blood clot. 4. Bluish, reddish, or pale-colored skin. Depending on your skin tone, the skin over the affected area might look red, blue, or pale. This is caused by the lack of oxygenated blood reaching the skin due to the blood clot. Now let's continue to the signs of pulmonary embolism or blood clots in the lung. This condition is life-threatening and requires immediate medical attention. Here are the warning signs. 1. Sudden shortness of breath. This symptom usually appears suddenly and gets worse with physical activity. You might also find it difficult to catch your breath even when you're at rest. It's because the clot obstructs blood flow in the lungs, reducing oxygen levels in the blood and making it hard to breathe. 2. Chest pain. The pain is usually sharp and stabbing, and it may become worse when you take deep breaths, cough, or exert yourself. This is because the clot causes inflammation and irritation in the lung tissue, leading to pain. 3. Cough. The cough may be associated with bloody or blood-streaked mucus. 4. Rapid or irregular heartbeat. This can be a sign of strain on your heart. Rapid heartbeat occurs because your heart is trying to compensate for the reduced oxygen levels by pumping blood more quickly. Now let's proceed to the warning signs of blood clots in arteries or arterial thrombosis. Blood clots in arteries can cause severe and immediate health issues because they block the flow of oxygen-rich blood to vital organs and can lead to heart attack and stroke. So, it's important to be aware of these signs to prevent further complications. 1. Upper body pain. You may feel pain or discomfort in one or both arms, the back, neck, jaw, or stomach. The pain can radiate from the chest to other areas due to shared nerve pathways. When a clot blocks an artery in the heart, it can cause chest pain that radiates to other areas. This is known as referred pain and occurs because the nerves that supply the heart and those that supply the arms, jaw, and other upper body areas converge at the same spinal cord segments, leading the brain to misinterpret the pain's origin. 2. Numbness in a portion of the body. This can occur if the clot is blocking blood flow to a certain area, causing it to lose sensation. When blood flow is obstructed, the affected area receives less oxygen and nutrients, leading to numbness. This is particularly common in strokes, where a clot in the brain can cut off blood supply to specific regions, causing sudden numbness or weakness, especially on one side of the body. 3. Headaches and chest pain. A clot in an artery leading to the brain, such as those in the carotid arteries, can cause intense headaches due to the lack of oxygen. Similarly, a clot in a coronary artery reduces blood flow to the heart muscle, causing chest pain or angina. This pain results from the heart muscle being deprived of oxygen, a condition known as ischemia. 4. Lightheadedness or dizziness. This can occur if the clot is in an artery that supplies blood to the brain. You might feel dizzy or lightheaded, and in severe cases, you could faint. This is because the reduced oxygen levels in your blood can affect your brain, leading to dizziness and fainting. 5. Abdominal pain. When a clot blocks an artery that supplies the intestines, it restricts blood flow, leading to intense abdominal pain. This condition is known as mesenteric ischemia. This pain is often sudden and severe, and can be a sign of a medical emergency. So, while you can't completely eliminate your risk, there are ways to help prevent blood clots. Stay active. Get your blood flowing regularly with exercise. Move around. If you have to sit for long periods, get up and walk around every hour or so. Maintain a healthy weight. Excess weight can increase your risk. Drink plenty of water. Dehydration can thicken your blood. Wear compression stockings. These can improve circulation in your legs, especially during travel. If you experience any of these warning signs, seek immediate medical attention.